the second of the presentations by our honorary professor. I'll take this opportunity to welcome everyone to our session at this HU Center for Health Economics. My name is Roger McLean. I am research fellow and lecturer attached to the HU Center for Health Economics. And today, it's our pleasure to welcome our honorary professor, Professor Patricio Marquez, who will be presenting on assessing the social and economic dimensions of mental health and well-being. The session will run for an hour. Professor Marquez will present. There will be a period of question and answer, which will follow soon, immediately after, and we will end. We are carded to end at 11. Let me begin by giving you a brief background on our honorary professor and presenter today. Professor Marquez, Patricio Marquez, is a former public health specialist for the World Bank Group and recent recipient of the title of honorary professor from the University of the West Indies. Apart from his work in over 80 countries and his 32 years of service at the World Bank, Professor Marquez has also served as a consultant to the World Bank post-retirement for the preparation and implementation of the global COVID-19 emergency response program over the period 2020 to 22, covering more than 110 countries. He is a senior associate of Johns Hopkins Bloomberg School of Public Health, a member of the International Advisory Committee for the Global Mental Health Program at the University of Washington, and a member of the International Advisory Committee for the World Non-Communicable Diseases for the 2023 conference, among a list of other areas and activities that Professor Marquez is involved with. Professor Marquez also boasts quite a good, long and fruitful relationship, not only with the University of the West Indies and HU Center for Health Economics, based on his contributions in the area of HIV, but the broader regional response. A lot of us would know Patricio has been in the trenches with us in the early days when we were seeking to move HIV on the public agenda, policy agenda. And so he is by no means a stranger to us at the University of the West Indies and the HU and by the wider region in terms of the HIV response. During his year attachment at the HU, one of the things that Professor Marquez intends to do is to focus on the process of transfer of knowledge and experience, sharing his knowledge and experience with the younger individuals involved in the development of the health agenda in countries and communities. And so we are really pleased to have had Professor Marquez join us at the HU Center for Health Economics, and equally pleased to have him present here to do the second of his presentations today, looking at assessing the social and economic dimensions of mental health and well-being. And so without further ado, I would like to introduce Professor Patricio Marquez to present to us this morning. Patricio, over to you.
Yes, good morning, colleagues. Can you hear me well?
Yes, we're hearing you clearly, Patricio.
Yes. Okay, very good. So first of all, many thanks to Roger for the kind introduction and to the colleagues at the Center for Health Economics for helping organize this event. I should begin by indicating, as probably some of you know, that May is Mental Health Awareness Month. And since its inception in 1949, Mental Health Awareness Month has been a platform for addressing the challenges faced by millions of people across the world who suffer mental health conditions. This platform has also offer the opportunity to advocate for efforts to eradicate stigma associated with mental health conditions, extending support to those in need, foster public education, and advocating for policies that prioritize the well-being of individuals and families affected by mental illnesses. So, having said that, to set the context, my presentation should be seen as part of that effort to advance this agenda across the world. During my presentation, I will focus on several topics, and I will begin addressing each of these topics by sharing with you some key messages. The first message that I would like to share with you, colleagues, is that mental health is a fundamental aspect of everybody's life, influencing our emotions, our interactions, and relationship with others, and even our physical health. It's an integral to our overall well-being and should not be stigmatized. And more importantly, colleagues, we must reframe mental health as not just an individual concern, but as a societal challenge. It's critical that we differentiate mental health, or what we mean by mental health, from mental illness. Sometimes those terms are used as synonyms, but they are different. While mental health refers to the capacity to think, feel, and act in ways that enhance our ability to enjoy life and deal with challenges, mental illness refers to conditions that affect a person's thinking, feeling, mood, or behavior. So I would like to stress the need to differentiate the terms. Mental health and well-being are part of a continuum, healthy to severe disorders. The second message is mental and substance use disorders have often been neglected in the global and developmental agendas. Indeed, colleagues, this has been the irony of this issue, given the magnitude of the burden. We now realize that discussions about health and well-being are incomplete unless they acknowledge that mental health deserves the same level of attention as physical health, more so right after the COVID-19 pandemic, when the issue came to the forefront as kind of a tail end of the infectious disease crisis that all of us face. The importance of mental health can be better appreciated by realizing that mental disorders are the 7th leading cause of disability-adjusted life years, and the 2nd leading cause of years of productive life lost due to disability. If you see this graph, you see how mental health fares in comparison with other health challenges. The red here circle indicates the relative position or the relative importance of mental health vis-a-vis other health issues. And depressive and anxiety disorders are among the top 25 leading causes of DALYs worldwide. So These figures clearly illustrate that we are dealing with a burden that is extracting a major toll on societies across the world. We also need to realize that mental and physical health are syndemic. One affects the other, but also people who suffer from mental health conditions have more than double the lifetime risk from serious health problems. People's economic, social, rational, civic, and environmental experiences shape or in turn shape by their mental health. This key finding comes from a recent report that was released last year by the OECD, How to Make Societies Thrive, coordinating approaches to promote well-being and mental health. And in this report, it was clearly indicated on the basis of country evidence that community relation aspects, such as the quality of people's relationships with each other, their community, and their public institutions, can influence and, in some cases, be influenced by their mental health. Well-being deprivations, including feeling and being unsafe in one neighborhood's home or society, and inadequate work-life balance, loneliness and social isolation, and poor motivation to participate in civil engagement are all linked to elevated risk of mental ill health and lower positive mental health. Among those, the factors that need to be highlighted are the epidemic or the silent epidemic of intimate partner violence, the most common form of violence, the violence worldwide, that is a specific risk to personal safety with substantial mental health consequences. Likewise, part of feeling safe also includes freedom from discrimination, work-life balance, being able to combine family commitments, leisure, and work is an important factor for the mental well-being of people. There are other factors that need to be considered, such as the health impacts of unpaid work that tends to be highly gendered, social connections, as I mentioned before, encompassing the time spent and relationships with others, including both quality of time, including both quantity of time and aspects of quality, whether people feel supported and whether they feel lonely. These factors are strongly associated with mental health and well-being. From a clinical perspective, colleagues, social connectedness is often operationalized as social functioning, or the degree to which a person is able to fulfill various roles in social environments. Civic engagement is also important and can influence the mental health conditions of people, as the perceptions of public institutions can be a risk factor for poor health. And more recently, colleagues, especially, it became quite visible during the COVID-19 pandemic. We are starting to accumulate a growing body of evidence on the negative impact of excessive social media usage. Hyperconnectivity has a potential to change patterns of social interactions, as face-to-face interaction that's essential to the give and take function of family, communities, and workplaces are substituted by online interaction. Digital media consumption may facilitate bullying, harassment, social defamation, and hate speech. All of these factors contribute to our poor mental health. Excessive media uses reduces attention span, lowers recall rates for information people believe they can access easily online, and reduces levels of empathy, perhaps as the result of the decrease in face-to-face communication. Strong evidence also exists that short-term exposure to media violence in younger viewers stimulates immediate aggressive behavior with their peers at school. The evidence is accumulated, as I said before, on how mental illness are linked to social media usage. Depression, failure to meet expectations presented by other social media users, attention deficit, hyperactive disorder, addiction to the constant need to use social media apps, resulting in neglect of other social aspects of life. All of these are manifestations of a growing crisis associated with digital and social media usage. Message 3. The social cost of inaction up to now has been high and continues to be high. Why? Because of the important role of mental health for individual and societal well-being. The COVID-19 colleagues exacerbate the pre-existing vulnerabilities and expose new risk factors for mental health. The population dealt not only with direct health impacts of the virus, but also financial insecurity, job loss, disruptions to education, and increased social isolation. In the meantime, new threats to mental health, such as climate change, have emerged or have become increasingly urgent. Mental ill health overall, colleagues, can have a devastating effect on individuals, families, and communities. One in every 2 persons experiencing mental illness in their lifetime. This is based on OECD findings. And individuals experiencing mental ill health have poorer educational, employment, and physical health outcomes than those in good mental health. Findings from several countries indicate that people with mental health problems are more likely to stop full-time education early, therefore hindering human capital development in countries. Most people with a mental disorder tend to work, but the employment gap is significant, as we can see in this graph. And people who are dealing with mental ill conditions have the higher risk of unemployment than those that do not face the same problems. From an economic perspective, both using estimates from direct and indirect economic costs, mental ill health also weighs heavily on societies and economies. Its economic burden can rise up to 4% of a country's GDP. Message 4. Poor mental health is the most common cause of misery and deprivation. In these, colleagues, there is a vicious cycle of poverty and mental disorders. Poverty leads to economic deprivation, indebtedness, low education, unemployment. That leads to social exclusion, high stressors, reduced access to social capital, safety nets, malnutrition that contribute to mental disorders, high prevalence, and lack of care, which in turn increases health expenditures, loss of employment, reduced productivity, increased substance use, and all contributes to aggravate and to accentuate poverty challenges. But beyond material well-being, we need to move to frame this discussion towards importance of happiness. Recent research done by Professor Lord Laylar from the London School of Economics show that what matters most to people's happiness are social relationships and good mental and physical health. People feel deprived when they cannot enjoy life, and mental illness is more common cause of misery, poverty, or unemployment, although both of them are interrelated. If we keep in mind that human capital is the main factor that contributes to the wealth of nations, then a critical global challenge now is how we create well-being. So we need to focus on mental and substance use disorders and their negative consequences, such as domestic violence, alienation, and suicide. Message 5, there is no wealth without mental health. To explain this, we need to ask, where is the wealth of nations? Usually, countries track the gross domestic product as an indicator of their economic progress, but they don't track wealth. Wealth understood as the assets in a country, such as infrastructure, forests, minerals, and intangibles, such as human capital, social capital, quality of institutions that produce gross domestic product. World Bank studies have shown that human capital, the value of earnings of a person's lifetime, is the most important component of wealth globally. According to bank estimates, human capital accounts for roughly 2/3 of global wealth. So we need to, within this context, we need to pay close attention to the importance of mental and physical health for human capital development. Human capital includes not only the number of years of schooling complete by workers, but also the earning gains when schooling and how long workers can work, which account for health conditions through life expectancy, among others. The different dimensions of human capital, colleagues, complement each other, starting at early age with proper nutrition, stimulation in utero and early childhood. All of them have contributed to improve people's physical and mental well-being and the development of cognitive and socio-emotional skills. Therefore, investing in mental and physical health should be seen as a critical contribution to build health capital, and hence human capital, which contributes to increase the wealth of countries. But besides extending, but this discussion needs to go beyond individual productivity. When we talk about human capital, we need also to take into account all kinds of societal benefits. It reduces the probability of crime, increases social participation, builds social capital, by making people more trustworthy and tolerant, and could help stave off social instability. Message 6. There is a substantial gap between service need and provision, but there is a large body of scientific evidence to guide a scale-up implementation of interventions to deal with mental health disorders. On top of the human suffering, colleagues, mental disorders generate their social and economic impact is overwhelming. Yet, the irony is that in most countries, the social response to mental health challenge is woefully inadequate. Millions of people suffering from these conditions do not seek help due to stigma on one hand and lack of services. There is an abysmal gap in treatment. Around 80% of people with severe mental disorders in low and middle income countries receive no treatment. The corresponding figure in developed countries is around 40%. This is information coming from the World Health Organization. And when services are offered, patients face huge problems of quality. And the situation is no better in specialized units that operate more than as a custodial service rather than therapeutical institutions. And the situation, colleagues, is even worse in prisons for incarcerated populations. As I said, there is a large body of scientific evidence that could be put to use, that could be translated to help advance this agenda in order to overcome inaction. In recent years, a lot of effort has been placed in collecting evidence on the cost effectiveness of different interventions. And on the basis of this evidence, estimates have been prepared that show that while the social cost of inaction is alarmingly high, the cost of effective interventions is relatively low, as we can see in this graph in relation to depression and anxiety, that show that the ratio of benefits to cost for scale treatment is quite high. Message 7. Beyond myth and stigma, we need a fresh approach to service provision across different sectoral platforms. So this is not only a challenge that requires the delivery of services, but more importantly, it requires that we tap and use entry points across different sectors using different programs and leveraging existing resources across sectors. In the health sector, for example, colleagues, we can mainstream mental health, taking advantage of the consensus around universal health coverage. Leveraging this opening requires that we adopt integration as the guiding principle for organization, financing, and delivery of health services. We cannot afford to duplicate or to establish parallel efforts. Mental health services need to be linked with physical health services within the platforms of the service delivery platforms offered by under primary healthcare initiatives. Mental health should be part of the global and local agendas related to non-communicable diseases. And we need to accept the reality of comorbidity. given the fact that both physical and mental health are syndemic. And also, we need to migrate from the idea that mental diseases have to be treated in secluded clinical spaces and to expand the use of a comprehensive approach in the treatment of these disorders, integrating mental health and physical health services and including medication, psychotherapy, and other types of therapies are part of primary healthcare platform. As we have seen during the pandemic, digital and social media, while presenting challenges in the excessive use and our daily addiction to those tools, they can also play a positive role given the growing popularity and the use of mobile devices to access them. Why? Because they can help improve access to care and help reach vulnerable populations, particularly in low-income cities where there is a lack of or limited availability of mental health resources. These platforms, these virtual platforms, can facilitate remote screenings, diagnosis, monitoring, and treatment, as well as remote training for non-specialists, and can enhance online peer-to-peer support and self-care, helping overcome or bypass stigma and discrimination barriers. For the delivery of services within the health sector, there is a need for a major decentralization, moving away from psychiatric facilities that have for centuries played a custodial role with patient care and community-based services, as recommended by the World Health Organization. In the health sector, and given its impact on human capital development, a critical entry point should be the integration of care for depression in primary, maternal, and pediatric care. Depression can negatively affect management of common co-occurring diseases such as diabetes, hypertension, cardiovascular diseases, and cancer. And we also need to take into account that more than one half pregnant women suffer from symptoms of anxiety, and more than 1/3 suffer from symptoms of depression. And about 15% of new mothers suffer from perinatal depression. These interventions are needed in order to prevent the intergenerational transmission of poor health from the mother who are experiencing all these problems to the child. And one of the obvious, more visible effects of that transmission is stunting that tends to be observed to be more prevalent among children whose mothers were affected by domestic violence and in turn by mental ill health. All of these tell us that we need to start addressing mental health early in life, not only during pregnancy, by focusing on the needs of the mother, during the postpartum period, in order to facilitate and support the emotional connection between a mother and a child. That's vital for the development, the emotional and psychological development of children, but also at the school level. We need to find that as the school as an entry point to promote mental well-being. So we can start early, preventing rather than waiting for negative outcomes later in life. And there are several examples in different countries that are part of the Commonwealth, such as Australia, where services are delivered at the school level for young people between ages 12 and, and above. And these type of services offered at the school are not only related to screening, but also to teaching ways to cope with crisis, to overcome with trauma, as well as to deal with the negative impacts of excessive social media use. All of this with the goal of facilitating social, emotional, and the and the skills children, particularly empathy and healthy relationships with others. Message 8: integrating mental health as part of the wellness programs in the workplace should be seen as a sound investment. And also, we have to consider that by involving the employers, we are going to be able to leverage private capital in order to advance the universal health coverage agenda by bringing services to workers and to their families in the workplace was part of the workplace arrangement. The question is why we need to focus on workplace mental health. Data from the United States shows that the ratio of working age adults in the US experiencing mental disorders is 1 to 3. 13 to 30% is the percentage of time at work in which depressed employees have impaired performance. Lost productivity amounts to $44 billion due to depression alone, and 87.5 billion US dollars is the amount spent annually in the US on healthcare for mental conditions. All these numbers indicate the importance of thinking about bringing mental health as part of the wellness programs in the workplace. Why? This is a sound investment, as I said before, because mental health contributes to lower productivity and more sickness absence, based as shown in this graph that summarizes evidence from different countries in the OECD. So how can we promote mental health and well-being in the workplace? By developing an employee-centered wellness culture in the workplace, providing supporting environments where safety, respect, and equal treatment to all are ensured, work-family balance is codified in the institutional culture, and facilitating access and opportunities for employees to engage in a variety of workplace health and wellness programs. Those are key investments that need to be seen as an investment rather than an expenditure by employers. And in a study done by the World Economic Forum shows that the investments are highly profitable, if I could use that term. This survey covering 25 firms with 2 million employees and 125 countries around the world found that firms that champion workplace wellness are reaping significant benefits in terms of increased productivity, reduced cost of employee healthcare, and increased employee engagement, leading to reduced turnover. So these investments are good for the bottom line companies, mainly because of reduce preventable healthcare expenditures because the population is healthy, but also increase the top line of firms, mainly because it increases productivity and competitiveness. A good example in the making is the implementation of the Better Together, a mental health and well-being strategy for the World Bank Group that's promoting the mental health and well-being of staff by identifying mental health issues proactively and resolving them, protecting mental health by mitigating work-related stressors and risk factors, by creating a positive workplace in collaboration with managers, staff, and health and social experts, and supporting staff and their families who face mental health problems and recovery. I had the opportunity to contribute as a co-author to prepare this strategy. I'm very happy to report that's under implementation right now with concrete gains within the institution, particularly as it has helped raise the awareness about the importance of mental health in the workplace. Message 9. Bringing mental health into humanitarian and development programs for displaced population and refugees, as well as host communities, is critical, particularly during this period of time when we are, all of us, witnessing conflicts and wars across the world that in turn contribute to the displacement of large numbers of people within countries and across countries. It's estimated that more than 60 million people are forced into this, are live in forced displacement and extreme poverty, fleeing conflict and violence nowadays. Inflows of displaced people can cause social and economic challenges and disruptions to host communities. The issue of displaced people requires action to support economic activity, job creation, and social cohesion, as well as to strengthen and expand essential services, not only for the migrants and the refugees, but also for the host communities in the areas that are receiving this influx of people. We have to be mindful that armed conflict and violence disrupt social support structures and expose civilian population to high levels of stress. There is a high level of prevalence of common mental disorders such as depression, anxiety, and post-traumatic stress disorders among this population. So what's required, especially during these times, is the adoption of multisectoral approaches that integrate the delivery of physical and mental health services at the community level in schools and in workplaces to explicitly address the mental health and psychosocial needs of displaced people in host communities. These services need to in particular address alcohol and other drug issues problems, as well as include innovative social protection and employment schemes that facilitate the reintegration of affected persons into social and economic activities. Message 10. There are other cross-sectoral policies and interventions available to make improvements, including integrating safety and social connectedness into urban design, making better social connectedness an explicit social priority, tackling the gender gap in pay level, and expanding the representations of those with little experience in politics. So, colleagues, this latter point brings out the need to focus beyond the health sector across different entry points to address the multiplicity of drivers that contribute to the onset of mental ill health. All of these, colleagues, requires funding or additional funding. So the message 11 is innovative financial mechanisms are needed to support the global scale-up of mental health services as part of the progressive realization of universal health coverage and the Sustainable Development Goals agenda. As I said before, estimates that has been done show that the mainstreaming or the adoption of a package of essential mental health services is highly cost effective. The cost per capita ranges from $2 US in Africa, in countries in Asia from $3 to $4, and in countries in the Caribbean and South America, Mexico, the cost ranges between $7 and $9 US of additional resources that are needed to mainstream mental health services or basic health services as part of existing platforms. So the question is, how are we going to finance this expansion that's required? Colleagues, I think that in spite of resources flowing from different external organizations, both bilateral and multilateral, it's inescapable that domestic resource mobilization should be seen as a core priority for the Sustainable Development Agenda. And this was codified as part of the 2015 Addis Ababa Conference on Financial for Development, where countries committed to mobilize additional resources using via taxation. And as part of the resource mobilization agenda, as we have discussed before in another presentation, the pro-health taxes agenda offers a potential source of dedicated funding by increasing taxes on tobacco, alcohol, and sugary sweetened beverages in order to mobilize additional resources and expand the fiscal space to facilitate these investments that are needed in order to advance the mental health agenda. The good thing about these taxes is that they not only help broaden the tax base in a country by generating additional revenue to support budgetary capacity to finance universal health coverage and mental health scale up, but also they reduce health risks, therefore, in the medium term, reducing the need for specialized medical services when the population that's healthy doesn't require. Blending financing, that means leveraging donor funding and domestic resources would help attract private capital. And this is needed, especially in terms of fiscal austerity, in times of fiscal austerity, so that those resources coming from private sources can help expand the pool of available resources for these priority investments. there are mechanisms in place, and there are concrete experiences on how blended financing can be structured. So to conclude, colleagues, let me share some takeaways in the form of 3 key considerations for guiding action. First of all, when? It's critical that we advocate for early intervention to prevent long-term costs. How? We need to advocate for making the right services widely available across health, social, and employment sectors. Again, reiterating the need to see mental health and mental well-being not only as a health issue, but a societal challenge that requires interventions across sectors. Therefore, we need to explore and tap different entry points across sectors. Who? We need to improve the competence of key actors for the delivery of those interventions. To conclude, colleagues, I would like to end by quoting the former Minister of Health of Canada, who said that almost no one in society is left untouched by mental illness, directly or indirectly. Sometimes without even knowing it, mental illness affects nearly everyone at some point in their lives. Therefore, by advocating all these actions to deal with the inaction that has characterized policies and programs that have been adopted in countries for decades, we will be finally starting to respond from a moral standpoint to the needs of an abandoned group who have historically been victims of neglect, poor treatment, and often appalling human rights abuses. Thank you.
Thank you very much, Patricio, for an extremely informative presentation. Folks, we had the pleasure of hearing Professor Marquez presenting on the topic of assessing the social and economic dimensions of mental health and well-being. In Patricio's presentation, he centered his presentation on around 11 key messages. The first spoke to mental health as a fundamental aspect of life and integral to well-being, where he provided a sort of a context and definition, highlighted the importance of mental health as a social challenge, and made the distinction, of course, between mental health and mental illness. The second message spoke to mental health and substance abuse and use disorders and its neglect, making a very important link between and distinction between mental health and physical health. He identified in so doing the importance of mental health by illustrating it within the context of disability life years and productive life years, illustrating that mental health is 7th among the DALYs and second leading cause of productive life years in 2019 data, making that direct link again between mental and physical health. Critical to that is the importance of the link between mental health as an influencer and influenced by social, economic, relational, civic, and environmental factors. He flagged the very important use of the role of social media as a negative variable within the context, but later on went on to highlight it as a potential factor that could be used to address the issue. The issue of social cost of inaction was identified as one of the key messages, looking at it within the context of the GDP, as we as health economists are quite aware of, 4% of GDP based on some of the estimates provided. And for us who are dabbling in that data, we know that 4% of GDP invariably counts on its own to a significant chunk of our health budget on its own. His fourth message spoke to mental health causes of misery and deprivation, linking mental health to poverty. Message 5 spoke to the link between wealth and mental health, linking it within the context of human capital. The sixth message spoke to the gap between service need and provision, while his seventh message spoke to the myth and stigma and the need for a fresh approach to service provision, making a case for mainstreaming mental health and integrating mental health and within the context of the physical health services and the role of media in that context. Message 8 highlighted, building on message 7, the importance of integrating mental health as part of wellness programs in the workplace, particularly when one looks at the cohort of persons that are impacted on by mental health. And Patricio went on to illustrate by way of evidence the significant chunk of the labor force that is impacted on by mental health. Message 9 spoke to the humanitarian efforts that are needed within the context of displaced populations and refugees, making a case for a multi-sectored approach. And as he wound up, he spoke to the issues of cross-sectional policies and interactions that are available to improve mental health, the importance of innovative financing mechanisms in messages 10 and 11, ending on 3 critical takeaways that spoke to early interventions as a critical aspect of the addressing and minimizing the long-term costs, the importance of making the right services available across the sectors, and of course, the critical aspect of improving competencies among the critical service delivery points. And so we want to go straight to, we've asked during the session persons to do 2 things. One is to include your name, email address, and organization that you represent. And we've been seeing those coming through. So thank you very much for facilitating. Those of you who have not, please do so. And as we turn to our question and answer sessions, we've asked persons to include questions from the floor. I'm going to select some of the questions that were presented here, particularly those who I think that Patricio can speak to. One question, Patricio, I will speak about, I will read out three of them, and then you can speak to them. Beyond material well-being towards happiness, what are your views on how mindfulness practices might support this intervention? Let me repeat, beyond material well-being towards happiness, what are your views around mindfulness practices, around how mindfulness practices might support this intervention? The next question that I'd want you to ponder on is a question that is asking about whether there is information on the impact of social media, particularly false information, misinformation on mental health, for example, in terms of its impact on vaccine hesitancy, etc. The third question has to do more within the context of data availability around the cost of mental ill health and its impact on Caribbean workplaces. So I ask you, Patricia, if you could speak to those 3 questions in the first round, and then we'll ask us.
Yes, thanks, colleagues, for posing these important questions, and thanks, Roger, for the reframing and the synthesis that you provided after my presentation. In relation to the first point about efforts to improve the mental well-being of people in order to address the challenges, misery and deprivation. Certainly, mindfulness, and particularly the promotion of social connections, the building of interactions and social capital are all of them are key in moving this agenda forward. In relation to excessive social media use and the role of disinformation, yes, there is a growing body of evidence that I could pinpoint to you if you are interested in delving into the topic in more detail, particularly coming from work that has been done with the support of the World Economic Forum, that has been collecting information on how the excessive use, and I will say excessive use in order not to equate digital media and social media to the problem, but rather the excessive use, and certainly how information is used and manipulated for certain ends, and that causes the problem. Yes, as I said, I could direct you to a vast body of and growing body of evidence on this topic, but also I think that yes, social media manipulation in terms of conflicting messages, if I would use that term in a charitable way, contribute to spread misinformation about the potential or the perceived dangers of vaccines. I think that that's an issue that merits a good discussion, mainly because we have to realize that no medicine, including vaccines, is 100% safe. But the challenge, in order to have a good understanding of the issue, is to be able to compare the risks and the potential benefits of the vaccine. In the case of the COVID-19 vaccine, for example, it was very clear that based on pharmacovigilance and related monitoring efforts, it show that, as with any other medicine, certain vaccines generated some side effects or adverse effects in a small number of the recipients of the vaccines. However, this risk compared to the benefits of preventing the development of the COVID-19 disease with all its complications, particularly among people who have who already had pre-existing conditions, as well as the reduced risk of being hospitalized or even dying from the disease, clearly signal that the benefits far outweighed any risk of side effects. So the misinformation focus only on the perceived, on the side effects, some of them very mild side effects among a small share of the population who were vaccinated. And they forgot to mention the reality that all medicines have side effects, but more importantly, they forgot to bring out the benefits and compare the benefits of being vaccinated to the risks of being vaccinated. And as I said before, the evidence is clearly shows that the benefits of being vaccinated far outweigh any minor risks that do exist. And perhaps from a public health perspective, one of the key lessons going forward is that we were not able to communicate clearly about the benefits and how those benefits compare to the risks. So that's a key lesson that we were able to derive from the COVID-19 experience. But misinformation, yes, bullying, the anonymity of harassing people certainly is present in the excessive use of social media or in the use of social media. And that needs to be confronted, that needs to be regulated. And I think in different countries, more recently in the United States, probably you saw that the CEOs of some of the largest technological firms were invited for a session in the US Congress that was convened to discuss the dangers of social media use, of misinformation, and the negative impacts of its use, particularly among children and adolescents. So the issue is open, is in the open. The discussion of what to do is something that is taking place in different countries. The issue of regulating the use is part of the agenda of the European Union right now, is part of the agenda of the United States, and certainly that's under discussion in other countries across the world. In relation to the third question, Roger, could you remind me, please?
You see, the third question spoke to you spoke to the issue of the social media, really had to do with the availability of data around the cost of mental illness. Did you speak to that?
Oh, because of mental illness
Yes.
in the workplace. Yes, I think that, as I said before, the cause of mental illness in the workplace, and there are different estimates that have been done by different organizations and different bodies on the basis of estimating the direct cost of treatment for mental health conditions and the indirect cost, or let's say, or lower productivity measure in terms of absenteeism. What's the foregone income for people who don't show up for work, or the foregone financial impact on the production of goods and services, mainly because the employees are absent. So the estimates cover both direct and indirect costs and are widely available for countries as a whole, but also in terms for specific enterprises. In terms of enterprises or workplace or the cost in at the workplace costs at the Caribbean, I'm not familiar with those estimates, but I think that should be part of the research agenda for the Center for Health Economics to estimate that going forward.
Thank you very much, Patricio. And folks, with that, we have run out of time. There are a few other questions on the chat, but we will be entertaining them all. As you would have seen, there is a blog that would provide a platform for the continuous engagement. We will have Patricia respond to those questions as well. And some of the questions that are posed would also be questions that would engender a bit of exchanges within persons on the blog as well. So we urge you to stay tuned to the blog that is posted up on the chat. And that said, I'd like to take this opportunity to thank Professor Marquez for another informative presentation on a very important topic. This is something that, as he indicated, we will definitely be continuing to engage with our colleagues as we identify the importance of this critical issue for the well-being and overall development of our region. Once again, we'd like to thank participants who took the time for joining us today and to ask you to keep in touch, stay tuned. We will continue to engage you as we share with you and invite you to some of the other presentations that we have carded for the rest of the year. With that said, we'd like, on behalf of the HU Center for Health Economics, our Director, Dr. Althea Lafoucade, Coordinator, Dr. Christine Laptis, to once again thank you for taking the time, and do look forward to seeing you soon again. Do enjoy the rest of the day. Enjoy your weekend. Please stay safe, and we will be seeing you soon again. Thank you again, Professor Marquez.
One thing, Roger, if you allow me to put a request and make an offering. The request, could you share with me all the comments in the chat box, and I will try to provide some feedback on each of the comments that were posted there.
Yes, definitely.
Including providing a list of references for those people who would like to, who are interested in delving into more detail into this topic. I could share, for example, information about the cause of inaction. I could share with you, so in turn, those resources are made available through the Center for Health Economics. And finally, when browsing quickly the chat box, I discovered that my longtime friend Yolanda Simon was participating. So I would like to extend my best regard to her after so many years.
Yes,
thanks, Roger.
Hello, Patricio. Good to hear from you.
This is one of the Caribbean links in the fight on the HIV front that I made reference to. A pleasure having you, Yolanda, and of course, once again, thank you, Patricio, for having your presence here. We will definitely continue to engage with the audience and take the opportunity to share your responses and continue the discussion and the sharing of information. Once again, folks, thank you very much for your attendance, and we look forward to having you join us again soon. Thank you, and do enjoy.
Thank you, Roger.
Okay, bye. Okay. Okay. Thanks.
Okay.
Bye-bye.
Bye-bye, everybody.
Bye.
Take
care, everybody. Bye, everyone.
Bye-bye.
Bye.
Thank you. Bye.
Bye-bye, Patricio.